The honourable member for Thunder Bay, Superior North, regarding health.
Mr. Speaker, in 1958, Lester Pearson and Tommy Douglas collaborated to develop our world-class universal healthcare system in which every Canadian, regardless of their status, would receive medical care. At that time, funding for the system was split evenly at 50-50 between the federal and provincial governments. Close to 50 years have passed, and much has changed. The federal government share of the cost is now less than half of what it was at that time. Over the past decade alone, the cost of Canadian healthcare has risen by about 50%. This is quite worrying, since the cost of providing healthcare is growing faster than our economy or our population. This increase in cost does not seem to be tied to improvements in the quality of treatment Canadians are receiving. Wait times are as long as ever, and acute care hospitals like the one in Thunder Bay, Superior North, have been in gridlock for years. On January 26th, the Thunder Bay Hospital had nearly 100 more patients than beds. Patients, most of them seniors, were piled almost on top of each other like cordwood on cots in hallways. What's most worrying is that as Canada's population ages, there seems to be no relief in sight for our healthcare system. Canada needs some real leadership that is willing to take responsibility and invest in healthcare that will address the needs of our aging population. The Conservatives have instead decided to offload those responsibilities and the growing costs onto already overburdened provinces. Mr. Speaker, the Canadian healthcare system is in need of some serious attention. The last thing it needs now is for the Conservatives to cut and run as they are doing. It is the most vulnerable members of Canadian society who suffer the most from this government's irresponsibility. Canadians living in rural or northern or Aboriginal communities are facing a doctor shortage much worse than the rest of Canada. Our hats go off to rural physicians who struggle to take up the slack, like our own Dr. John Jackson Hughes did for 39 years in Nipigon, Ontario, in my riding in Thunder Bay, Superior North, before retiring this week. And even in urban Thunder Bay, 1/3 of our families have no family doctor. Historically, the federal government's role in healthcare has been to make sure that these kinds of discrepancies in care don't occur. But in March of last year, the Canada Health Accord was allowed to expire without any sort of plan to renew it or even replace it. Canada is the only country in the G20 without any national health care strategy, and it is starting to show, Mr. Speaker. Canada's global ranking in healthcare performance is dramatically decreasing, and this government's reckless cuts are only going to further increase that problem. Canadians can, however, take comfort in the knowledge that we're a world leader when it comes to handouts to oil companies. Mr. Speaker, the IMF has pegged this government's subsidies to fossil fuel companies at, wait for it, $34 billion per year. If that money were directed toward improving the health of Canadians rather than lining the pockets of some of the wealthiest corporations on earth, we would be well on our way to solving this issue. Poll after poll shows that Canadians consistently put health care among the issues most important to us. Why does this government place its priorities so far from those of Canadians? It's time for these Conservatives to start listening to Canadians. It's time for a national health care strategy. Do the Conservatives have any plan to restore the Canadian health care system? If so, we would love to see it. Thank you, Mr. Speaker.
The Honourable Parliamentary Secretary for Infrastructure.
Mr. Speaker, I'm pleased to address the comments from the honourable member with respect to healthcare funding. Our government is committed to a strong, publicly funded, universally accessible healthcare system that is there for all Canadians, both today and into the future. That's why we have continued to increase health funding to record levels, while at the same time ensuring that our government's long-term fiscal position is sustainable in order to continue to support the provision of high-quality healthcare services that Canadians have come to expect. In 2015-16, our government will provide $34 billion to provinces and territories in cash support through the Canada Health Transfer. This ongoing federal investment will continue to increase, surpassing $40 billion by the end of the decade. Even through the economic downturn, we have increased health transfers to the provinces and the territories to unprecedented levels. Mr. Speaker, combine this with the fact that health spending growth in Canada has actually slowed in recent years, the federal support for health care is even more significant. In fact, health spending has not exceeded economic growth since 2011. In 2014, provincial and territorial government health spending growth is forecasted to be at 1.9%, the lowest rate observed since the mid-1990s. All indications are that this trend of reduced health spending growth will continue into the future. Notwithstanding, our government has committed to extend the 6% Canada Health Transfer escalator through 2016-17, providing provinces and territories with additional fiscal room to meet their health care needs as they continue to address their respective priorities. The renewed Canada Health Transfer will provide provinces and territories with the certainty, stability, and additional fiscal flexibility to undertake needed reforms to make the system more effective and sustainable. Of course, improving health care is about more than just funding levels. It will require innovation to make the most efficient use of available resources. The federal government already plays a key role in supporting health care innovation and improvement, with investments of close to $1 billion per year through the Canadian Institutes of Health Research. On any given day, we are supporting close to 13,000 researchers across Canada who are working to discover new ways of treating illnesses and delivering health care. In addition, our government supports pan-Canadian organizations such as the Canadian Partnership Against Cancer and the Canadian Foundation for Healthcare Improvement, which serve as catalysts for building capacity and sharing innovations across the country. And I'm pleased to note that Economic Action Plan 2015 committed $14 million over 2 years for the Canadian Foundation for Healthcare Improvement. Mr. Speaker, provinces, territories, and stakeholders all agree that healthcare innovation can play a critical role in addressing healthcare challenges. Given the importance of innovation in healthcare, in June 2014, we launched the Advisory Panel on Healthcare Innovation to explore how our government can foster innovation, improve patient care, and the sustainability of Canada's healthcare system. The panel has been asked to identify promising areas of innovation in Canada and internationally that have the potential to improve the efficiency and the effectiveness of our healthcare system. The panel will report back in June 2015, offering its recommendations on how our government can best support needed change. Nous créons également.
We also are creating partnerships in order to assist the provinces and territories in making innovative reforms to health and providing concrete results to Canadians.
Clearly, we will continue to ensure that our healthcare system will endure as a source of national pride.
Honourable Member for Thunder Bay Superior North.
Thank you, Mr. Speaker. Mr. Speaker, the numbers speak for themselves. Conservatives have only $40 billion for health care per year versus $34 billion in subsidies to fossil fuel companies. How can this government consider subsidizing fossil fuel companies, some of the richest companies in the world, to be even remotely as valuable as our universal health care system? Canadian families, and especially seniors, are feeling the pinch right now. With our aging population, things will only get worse if this government continues to ignore the need for a national health care strategy. When will this government finally start prioritizing health care? And, Mr. Speaker, are the rumors true that if Conservatives get another false majority, we will be seeing more and more cuts to health care and more privatization of that health care? Thank you, Mr. Speaker.
The Honourable Parliamentary Secretary.
Mr. Speaker, our government remains fully committed to a publicly funded, universally accessible health care system that provides health care for all Canadians. That is why we have continued to increase health funding to record levels. Since our government took office, federal support through the Canada Health Transfer has increased by nearly 70%. The transfer will continue to increase, reaching over $40 billion by the end of the decade. Notre gouvernement demeure
Our government remains the largest investor in research in health in Canada, in partnership with the provinces and territories and stakeholders. We will continue to make efforts to bolster healthcare through investments in research and innovation.
To summarize, our government is clearly demonstrating our commitment to the future of Canada's healthcare system through fair and sustainable healthcare funding, support for research, and fostering partnerships in the pursuit of an innovation agenda that will further the quality, the accessibility, and the sustainability of our great healthcare system.